The Eastern Cape Health Department is celebrating International Nurses Day today with workers who make healthcare possible. The celebrations are taking place at the Madzikane KwaZulu Memorial Hospital in KwaBhaca. For more on this, we cross to SABC News reporter Fundiswa Mhlekude. A very good afternoon to Fundiswa. Tell us what's happening there.
Thank you very much, Nzinga. We are at Madzikane KwaZulu Memorial Hospital here in KwaBhaca in the Eastern Cape, where the Health Department MEC is hosting the celebrations of the Nurses International Nurses Day here in KwaBhaca. And earlier we just witnessed the arrival of Deputy Minister of Health, Dr. Madzikane, who is also here now at the tent. As you can see, if my colleague can show you, there is a tent here with a number of nurses who have come in their numbers to celebrate this day. You will also remember, Nzinga, that 2020 was declared by the World Health Organization as the year of the nurse, but unfortunately the nurses could not celebrate that year because due to COVID-19. DENOSA, the nurses organization, is also here. NEHAW is also here. Gift of the Givers is also here. They tell us that they are bringing about 300 gifts for the nurses. And at this hospital, Madzikane KwaZulu, we are told that there is a shortage of beds and linen. But with me is DENOSA Provincial Chair, Mr. Sivuyile Mange, who is going to be telling us about their status as the union, because we hear that, or we know that the COVID-19 infections are rising again. So let's hear from him. Mr. Mange, thank you very much for your time. COVID-19 cases are rising. Are you anxious as the nurses?
We are very much concerned as the nurses organization DENOSA because we know the experience that we have experienced in the past years in terms of COVID-19. However, today is a special day for the nurses of South Africa and the world, because this day is as a commemoration of the birth of Florence Nightingale, of which us as DENOSA, as an affiliate of International Council of Nurses, we are also observing this day. So however, this resurgence of COVID-19 in some parts of the country is becoming worrisome, because we know COVID-19 has exposed a lot of challenges in the healthcare system. So that is why we are a bit concerned, because those challenges are not yet addressed fully. As we speak, we know the theme of this year is talking to investment in nursing and also respecting the right to access to healthcare. So it's really concerning to us, because the government is doing contrary to what the theme is saying, that of investing in nursing. As we speak, we've got a challenge in terms of accreditation of nursing schools, whereby we know that's where we produce nurses, and we've got an aging workforce, and we lost a lot of nurses during COVID-19 pandemic. So it's really concerning to us at this present moment.
We have just heard that the hospital where we are right now has a challenge of lack of beds and linen. With COVID-19 infections rising, do you think that will be more of a challenge?
Yes, we need to look at the bigger picture. This is just as signs and symptoms what is being experienced by the various hospitals that we are in today. But the bigger picture here is the issue of the austerity measures that are put in place. And our view as DENOSA, the government should do away with the austerity measures, because everything that the challenges that we are experiencing now, all of them are circling around the budgetary constraints. So if the national minister and treasurer can address the issue of austerity measures, and the Department of Health be put aside in terms of that, at least this, in our view as DENOSA, that could be addressed, even the challenges that are faced by the very same hospital that we are in today.
Do you think the health department is ready for the fifth wave of COVID-19, of course?
Yes, as I'm saying, that there are a lot of challenges that have been exposed by COVID-19 in terms of human resources and staff. Because, for example, as we speak, nurses are very demoralized, and we've got a gross shortage of nurses. As we speak, we had a challenge here of non-absorption of 2022 post-com servers, and we've got also other categories that are so demoralized that are not getting their rural allowance as per the resolution 2 of 2004. That is the enrolled nursing assistant and enrolled nurses, of which they are covered by that resolution. So those are the areas that we need our department to address, so that we boost the morale of nurses, so that they can fight this pandemic. And the nurses, we want to appreciate them because they remain standing in spite of those challenges.
Thank you very much, Mr. Sivuile Mange, chairperson of DINOSA here in the Eastern Cape, saying that nurses are demoralized due to what is happening, saying that the health department is not investing more on nurses, and he is saying that these are just the challenges that they are facing are just a little bit of more that is happening within the nursing profession. Nzinga.
Fundiswa, Mhlekude giving us an update from the Eastern Cape.